Okay, now we're going to begin our urinary elimination lecture, and will be the first in the series. And I'll let you review the urinary system on your own. You can go back and review the physiology and that kind of stuff. The nephron is the functional unit of the kidney. I'll let you review that also on your own. I'd like to Okay, so on this slide, I'd like to talk to you about some of the changes in the urinary system as people age. One thing that you'll notice in older folks is that their glomerular filtration rate is going to decrease. And what makes this important factor is that you have to be careful of nephrotoxic drugs in the older people. So a lot of the drugs like the antibiotics, cyclosporin, amphotericin B, the aminoglycosides, all of these have nephrotoxic effects. And so with the elderly, you have to be careful. Some of the signs and symptoms that you'll see in the elderly with these drugs that will tell you that they're affecting their kidneys is the urinary output is going to start dropping down. And that's often an indicator that, these drugs are damaging their kidneys. Another factor that you need to be careful of is nocturia, because older folks get up 3, 4, 5, 6 times during the night. You have to think about safety. And so with the older population, make sure that you have night lights, that you remove any rugs or cords or furniture or animals that they may trip on. That's a real important factor with the older adult. They will have a decreased bladder capacity. And so with the older folks, you want to offer them a bedpan more often, offer them the opportunity to go to the restroom because they won't be able to last as long. They'll have a weakened urinary sphincter, and so there again, you want to make sure that you offer them to go to the restroom more often. And they also have a tendency to retain urine. And remember we talked about earlier that in the older folks, normally they'll retain about 100 milliliters of urine or more in their bladder, and so you have to be careful of urinary tract infections with the older adult. Okay, now these are terms that I'll let you review on your own. Anuria means that it's less than 100 milliliters. Oliguria means there's a lot of. I'm sorry. Oliguria means that there's from 100 to 500 milliliters in 24 hours, and then polyuria means that there's a large amount of urine. And normally with polyuria, we think of disorders like diabetes. Okay, and then there's two major categories of signs and symptoms that you're going to see. There's one that's called irritative manifestations, and this is where something inside the GI tract, not the GI tract, the genital urinary tract, is leading to irritation, inflammation. And the person will have urgency, frequency, nocturia, dysuria. And some of the causative disorders could be infection, inflammation, stones, or cancer. And the other main category is obstructive manifestations. This is where something is blocking the urine flow. And in these, you'll see things like hesitancy, where it takes a while before they can go, straining, where they have to really push to get the urine to flow. Intermittency means that there'll be some flow and then it stops, and then some more flow and then it stops. They'll also have decreased force, which means that it's not a full stream, but it's more of a dribble. And like we said before, they'll also have urinary retention. Okay, and on this slide, one thing I just want to mention is that term where it says flank pain or CVA tenderness. When people have disorders with the urinary tract, especially the kidneys, they're going to have pain on their back up where the ribs meet the spinal cord. And this is the costal vertebral angle, where they call it flank pain. And that's where they'll usually have that time of pain. Okay, so urinary tract infection, we talked about this a little bit early, so I'll go kind of quickly through this. But urinary tract infection is infection in the urinary tract. Most common place is the bladder. They call that cystitis. We talked about earlier that it's more common in women than men, and most of the time it's E. coli that causes it, but it can be other bugs also. And another reason why they develop these is if they have an indwelling urinary catheter and microbes can follow the tube up into the bladder. And the pathophysiology that we talked about earlier says that bacteria ascends the urinary tract. It leads to an inflammatory reaction, and then it will lead to infection of the urinary tract, which is normally sterile. And the signs and symptoms that they'll have would be dysuria, frequency, urgency, hematuria, fever, and pain. It's diagnosed with a culture and sensitivity. And remember, we send the urine for a culture and sensitivity before we start them on antibiotics. And treatment is we'll give them analgesics, antiseptics, antibiotics. And like I mentioned before, pyridium is a common antibiotic that they'll give to them, and you just need to let the patient know that it may turn the color of the urine orange or red, and it's good for them to know that before they start taking that. And another way to treat UTIs is to acidify the urine, and we talked about giving them cranberry juice or vitamin C, and then we also talked about increasing the fluids. And normally we increase the fluids like 2 to 4 liters per day to flush the bacteria out. And we talked about this one earlier also in that previous lecture, that culture and sensitivity, if you look at the top, you can see that culture means that's where they culture out the microbe that is growing in the urine. And you can see here in this situation, it's E. coli. And then the sensitivity down here at the bottom, you can see that they will check the microbe against the different antibiotics. And they will check to see if the microbe is sensitive, which means they're susceptible and it will get killed by the microbe, or if they're resistant, which means that microbe won't be killed by that antibiotic. Okay, so we also talked about incontinence, so I'll go kind of quickly through this one. We talked about physical causes. It can be things like immobility, fractures, restraints, weakness. It can be caused by psychological causes like dementia or confusion. And like we said before, incontinence is the involuntary loss of urine. We mentioned these earlier also. Incontinence, there's different types. The first one that we'll mention is stress incontinence. And this is where the person is exercising or exerting or coughing or sneezing, and they lose control of their urine. Overflow incontinence is where the bladder becomes overextended and they lose control. And then urge incontinence is where they feel that urge that they have to pee, and instead of, for most people, you can go to the restroom when you feel that urge. As soon as the person that has urge incontinence feels that sensation, they've already wet their pants, so it's too late for them. And then we talked about detrusor instability. This is something that you'll see in third and fourth semester. This is where they've had a spinal cord injury or a neurological injury, and you'll see it there. And so we won't talk about that a whole lot in first semester. And then the most common one that we will see, especially at a skilled nursing facility, would be functional incontinence. And this is where they lose control of the urine due to environmental, cognitive, mobility, or dexterity deficiencies. And I think I mentioned before, so if you have an older person, they fall and break a hip, you stick them in the bed and they can't get up and go to the restroom, well, a lot of times they'll be incontinent because no one offers them a bedpan. Or it could be someone has dementia and their body's saying, hey, I need to go to the restroom, but their mind is confused, and so they don't go to the restroom. And so those are the different types of incontinence. Interventions. We talked about earlier that there's collective devices like absorbent pads, undergarments, and diapers. Whenever a patient has these, you always want to be discreet with the person. You don't want to yell down the hallway and say, hey, Joe, do I need to change your diaper? Just try to be discreet and say, do we need to take you to the restroom? And help them that way. We talked about Kegel exercises. This is where they can strengthen the muscles of the pelvic floor, and it helps give them more sphincter tone. Bladder training, we talked about this earlier, and that's where we gradually increase the amount of time between voiding so that they can last longer without going to the restroom. And then we talked about different medications like the anticholinergics. We talked about obstructive devices and also surgical procedures for congenital anomalies.